Hi everyone. Sorry, my voice might be a little bit low this night. It's early morning anyway. It's almost 1 a.m. on my end. Please, if you are still awake, come, let's study. If you are awake, let us study. I have a gut feeling that a lot of people are writing exams, so we'll be writing the exams this weekend. That's why you saw me yesterday and you are seeing me again today. I just want to give little tips, okay, to those of you writing your exams this weekend. I might be here for 30 minutes. Oh my God. Calesta, you are here. Welcome. I might be here for 30 minutes. It depends, you know, as my spirit leads. I just want to give us little tips, okay, before I go to sleep. I need to sleep, but I just have a very gut feeling that someone might need one or two things. If you are here, just say hi to me. That will encourage me to stay. Just say hi to the host. Please, before you give nicotine to your patient, you know what to check? Check for the respiratory. Make sure that that person have a strong respiratory before you give nicotine to your patient. BAM, NCLEX alert. Do not aspirate heparin. When you are giving heparin, do not aspirate it. Do not massage it when you give aspirin. Please, heparin, sorry, do not massage the sites of the injection, okay? Please, do not remove the air bubble from the prefilled syringe before you administer heparin. Do not take out that air, okay? Please do not. When you see a question and the nurse gently, push out the air is wrong. About NCLEX, we put our word it a way that it will be inviting. You say, oh yeah, you don't air? No, I don't want to inject air into someone. Please, when it comes to heparin, don't worry about that air, okay? Don't take it out. Thank you so much. Do not. And it's only insulin syringe. Is only insulin syringes you use. Only, you see me screaming it. Only insulin syringes you use to do what? Give insulin. Please do not go looking for other syringes anywhere because you want to give Lynn or me some insulin. You start looking for, oh, is it this or that? No, it's not this or that. It's just the insulin syringe you use. Okay? Bam, bam. Those are NCLEX tips I'm giving you. Whatever I'm giving you on this silent night, don't joke with it. Okay? Right. When you are drawing the MPH and the regular insulin, we all know is RN. Everybody know. If you don't know it and you are writing your exam this weekend, please do not even near the piercing view. Do not near the hall. Do not even start driving because you need to know that when you are drawing MPH and regular insulin, you use RN, the regular, and the MPH. I hope you are listening to me. And how do you mix it? How do you draw it? the drawing. A lot of people told me they saw that on their NCLEX, and a lot of people are still seeing it on their NCLEX. You first of all do what? Start with your MPH, the MPH. Oh, Ingrid, how are you? You are welcome to my class. Is my silent night class. Okay. All right. You start with the MPH first. You do what? You push in air on the MPH. Then you now move to your regular insulin and you push in air. Then you now draw. As soon as you do what? You push in the air, you draw it. Then before you now go back to your MPH and now draw. Okay? But the normal way to do it is people just say, Aaron. How about the preparation? So I'm teaching you the preparation. Air first in your MPH and to the regular. Now draw from the RN, now the R before you go to the N. That is how we get the RN. Okay. I said that yesterday. Why does the adults, why do they get dehydrated? I gave that out yesterday. Go watch yesterday Silent Night and you will see that. And I told us, do not give milk to any child less than 1 year. It will cause dehydration for those child, for those babies, for those kids. Do not. Please, the Orthodox Judaisms, do not give them pork. Do not give them pork. They don't eat pork. The Jews don't eat pork. When any question have pork on it, is a wrong answer. Do not choose it. They don't eat pork. Okay. Yes. And also the Jewish, they eat the kosher food. When you see a question that said, I remember one question says that you help the Jewish person to open the kosher food. No, you don't. You just bring it as it has been pre-packed and give it to them. They have their certain way of opening their food. Okay? You just serve them the already prepared food. They buy it, because they have already prepared it the way they prepared it in their own belief. So you who is not a Jewish nurse or a caregiver, like a CNA, please do not help them to open that food. Leave it, they open it by themselves. Yeah. Yeah, you are listening. Okay. And I am talking while you are listening. Any baby, you see, I'm breaking everything down. Any baby born before 34 weeks, they lack coordinated sucking. The way they suck the breast. If this child is born before 34 weeks, NCLEX will ask you what problem they have. They have problem with suck swallow reflex. They may require tube feeding because they can't suck. So you give them tube feeding. Oh, Victoria, you are welcome. You should be sleeping. You just finished a class with me now. You should be sleeping. I say, go get sleep. All right. Please, any patient who is on hemodialysis, and you see an answer that said, this patient will need calcium, we need vitamin B6 and folic acid. That is the right answer. Yes, when this person is on hemodialysis. You know what that word hemo means? Blood. You dissect, you take out that blood from that patient. So you need something to supplement for those blood that's, that was out. So you need everything that will give that person blood. You need calcium, because this person's bone will be kind of brittle. You need calcium, and you need vitamin B6. You need folic acid. You need to replace what is taken out of that person. Okay. And everybody knows that when someone has heart failure, when you're treating someone for heart failure, and now you want to know if what you are doing is working, you make sure that you are weighing that person every day, same time, same clothes. When people see same clothes, they say, Miss Christiana, how do you think this person will wear the same clothes? It's not your clothes, it's their clothes. The book said it's their clothes, it's same clothes, give them same clothes. Don't think into that question. Same clothes, same time. The same clothes can be the hospital gown. Did you think about that? Yeah, so when they say same clothes, oh no, she wore it yesterday, today again, I'll wear it again. It's not your clothes. Give it, give her the clothes, okay? Same clothes, yes, okay. So you don't start reading into the question and you miss the answer to your question. Same clothes, same time, same scale, same everything. Yes, please. That is how you measure weight for when you are washing for fluids. When someone is having a lot of fluid in the system, in the that, once it's fluid, please weigh this person daily. Okay. A client with chronic renal failure. Renal failure. You are talking about the kidney whenever you see renal. Please don't mix renal with liver. It is kidney. Kidney. All right. Bathroom breakfast. Okay. All right. Yes. When someone is having chronic something that have stayed for a long time. Yeah, this person lives with this disease. All right. Please, you place this person on low protein. Remember, the kidney is not working very good. So you don't want to give this person what will overwork the kidney again. Put this person on low protein, on low potassium diet. Please, low, because the kidney is not doing the work it's supposed to do very well. All right. In a client or patient with type 2 diabetes mellitus, the more body fat that patient has, the more resistant this person will have for insulin. The more big this person is getting, if this person is getting little dosage of insulin and this person is getting more big, you know that what the question asks you, what do you anticipate the physician will do? The physician is going to increase the insulin level for this person because this person needs more insulin. They need more insulin when they are sick, more insulin. When they are stressed, more insulin. More. Just know that when a diabetic patient is sick, just say sick, more insulin. Stress, more insulin. Okay. But when a diabetic patient exercises very, very well, exercise to a diabetic patient is like taking insulin. So they don't need more insulin. When they are doing what? When they are exercising more, they don't need more insulin. But when they are sick, when they are becoming more obese, they need more insulin. All right. I have a gut feeling that someone needs this before the person goes for his or her own exam this week. That's why I am not sleeping. I like, let me give out one or two things before I go to sleep. Everybody talks about celiac disease, celiac disease, celiac disease, celiac disease. Oh, don't give this, don't, this is, please, if you said you know what this person need, you need to give to this person. Some questions now on NCLEX. A lot of people say, oh, I saw mashed potato. Yes, take it. Before they say only this oats, rice and corn. Please, if you don't see corn, you don't see rice, but you see mashed potato, take it is the answer. Okay, yeah, you are giving this person gluten free. Gluten, I want you to just think about it in one word. I let people to say is a kind of protein, a kind of fat that your body cannot digest. Yes. So anything that has no fat in it, take it. Mashed potato is now included. Corn, rice, mashed potato, you see it in your answer. Grab it quick, and say, Miss Christiana said I should take it. Yes, take it, okay? Yeah, I don't speak so much English when I'm doing my review, when I'm giving away things, tips, endless tips like I'm doing tonight. Um, why do you put a patient who have like a COPD patient, chronic heart patient, why do you put them sitting up, like sitting up the way I'm sitting? Why do you do that? You do that to facilitate breathing and to expand their lungs. Okay? Yeah, such questions comes in now. And a lot of people tell me, Miss Christiana, when I saw that question, I don't know what to take. Please take that you sit them up so they can breathe very well, so their heart, their lungs can expand. Okay? That's why you sit them up. I know a lot of people don't know that. Please, when someone goes for any procedure, I don't want to limit it to maybe breathing or lungs or this or that. Any procedure that a patient go to, keep that person MPO. MPO until the gag reflex comes back or returns. I am trying to put all this word in very simple English. Please, do not give me water, do not give me food, do not give me anything, do not give me jello, do not give me pudding. As soon as I come back from a surgery, do not wait and until the RN, if you are RN, if it is the MP or the doctor checks and make sure that my gag reflex means I can now swallow. Yes, before you give me anything. If you don't wait for my gag reflex to be back before you give me something, you might be choking me and I will die. And when I die, you won't see me come up here to give you all these endless tips. Please, I want you to remember why you do that. Okay, let's keep going. What time do you collect your sputum, their saliva, to check for tuberculosis? What time do you do that? You do that early in the morning. Like now, you see this early in the morning when I'm sitting here talking with you and you want to get that sample, that specimen from me. What you do, you give me water. Oh, hi, even Niger Mama. You give me water and I'll sip the water. You see what I'm doing? I squash the water and spit it out. Don't worry that I swallowed my. Please do not give me mouthwash if you want to get specimen from me to test for anything. Do not give me mouthwash, please. Do not give your patient, assume I'm your patient. Do not give me mouthwash. Just give me water and I will wash my mouth and just squash and throw it away before you take the sample you need, you need from me. Okay, and it must be collected in a specimen container, sterile specimen container. And how do you collect it? Oh, you tell me, Miss Christiana, Miss Lena, me, I want you to breathe deep and take out the saliva down your throat. And what you do with it, when I take it out, now I put it on the sterile container without my lips, without my mouth touching on the sterile container. Please, that question is hovering around everywhere, and I really want you to know about that. Any patient with any kind of heart problem, any kind of breathing problem should be positioned just like the way I am sitting, upright, Fowler position. Or sometimes you can see semi-Fowler. Yeah, but I will take Fowler anytime. Okay, I'll take Fowler position anytime over semi-Fowler. Okay, all right. So when the question is talking about COPD, please note that anything that makes you to retain O2 is classified as COPD. Any disease, asthma, all of them, emphysema, everything, anything that makes you to retain air, please. Because when people see COPD, their mind start running around everywhere. I want that to stop, okay? That's why I'm doing this for you. I said 30 minutes, but I think I'm staying more than 30 minutes. It's okay. When you are answering all these chest tube questions, bubbling here and bubbling there, you want to know where should be bubbling and where should not be bubbling. Okay. In the sealed, what did I say? In the sealed chamber, when something is sealed, there should be no continuous bubbling. If there is a continuous bubbling in the sealed chamber, please, something is leaking. You need to go get that tape and start looking for what is leaking and start taping it up. Okay, please, you tape it up. There should be no continuous bubbling in the sealed chamber. Please, it can be fluctuating. At breathing in and breathing out is okay. Fluctuation is good when it is sealed chamber. But in the suctions chamber, there should be continuous bubbling. If it is not continuously bubbling, that means it is not doing the work it's supposed to do, because it's supposed to be taking out either air or secretion or anything or water. Okay, so it should be doing its work. But in the sealed chamber, please, there should be no continuous bubbling. So when you the suction, when you see the suction chamber, just start looking for bubbling, 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 bubbling. That is the right answer. Okay. Please Do not clamp the chest tube during transportation or ambulation. When someone is going from one hospital to the other, or the person is walking around, do not go around clamping people's oh my God, Miss Christiana. Do not go around clapping people's chest tube. Okay? Please, whenever you see a question that say climb it until, no, it's not the answer. You don't go about clamping people, because when you clamp that chest tube, that thing that's supposed to come out, either water or air that was supposed to come out, is not coming out. So you don't go around clamping it. Okay. All right. You can only clamp a chest tube. Let's, for instance, you break the suction bottle is broken. So you climb it first before you now cut out that part that has touched the ground. Okay, you cut it out, and NCLEX is a beautiful, perfect word. Everything you need is there. So you grab that water. It doesn't matter what they said about that water, sterile water in a container, cup water, any water. There is nothing unique about the container that the water that contains the water, whether it's water bottle, whether it's cup bottle, cup water, anything. Once it's said, you submerge it. That is just the answer. That is all I care. That is all matters. That you put it into either the cup or the feeding bottle, whatever. Once it's water, and you unclamp. Okay? That is the only time you clamp. Please. And everybody knows that when you dislodged that chest tube, when you dislodge it, the best thing you do, the best, BEST, the best action you take when it is a best question, the best thing you do is you remember you are in NCLEX world. You are not in that hospital where you work. You are in NCLEX hospital. Everything there is perfect and ready, just waiting for you to use it. What do you do best is to take that. Sometimes they just say Vaseline jelly with 4x4. Yes, once you just see Vaseline in it, it doesn't matter where they put the Vaseline. Once you see Vaseline, that is the answer. Just first of all, use that Vaseline jelly and cover it. That is your best answer. But if they say first, maybe Miss Lynn or me is transporting this patient from E ward to A ward, and mistakenly I trampled on the cord and I dislodge it. What I do? What should I do? I have already have my glove hand, is a perfect word. So on that perfect word with my perfect glove, what do I do with it? I use it and close that hole, so I don't let air to go in and cause tension, worry. What? Tension, what? To the patient. Find that out. I don't want to give that away because you should know it. Okay. I am just giving us. Tonight, I'm just giving up. I'm giving out a lot. Yes, I said yesterday, when someone have HIV, please don't go around doubling your glove and dressing like you are going to the moon. If this person don't have other opportunity disease, please do not go around dressing like you are coming from the moon because you want to empty the urine of the person with HIV. Standard precaution is all you need. Okay, except that person start having like tuberculosis, that is when you start thinking about covering, maxing up. Then if you are doing anything that is going to cause splashes, like sunscreen or brushing, that is when you start thinking about covering up. Or you want to, and this person have wound, you want to give shower, that is when you start thinking about wearing a gown. You see, there is a reason why you do what you're doing. So when you look at a question, know what that question is asking. don't don't just see HIV as oh yeah, okay, HIV. Let me just wear this and wear that. And imagine you are just staying in your room and you page me to your room, and just I picked the phone and asked, "Oh, Miss Christiana, what do you need?" He said, "Please, I just urinated on my urinary. I want you to discard it." And you see me show up with all this, oh my God, like I'm going to the moon. I will scare the shit out of me. Yeah, so you don't want to do that. It's just simple, universal, standard precaution. Wear your glove, go take out the urine, take out your glove, wash your hand, and that is it. Okay. I talked about oil monitor yesterday. Please, if you didn't watch that video yet, please go watch it. When a patient have a left-sided heart failure, what are the signs and symptoms you see? And when a patient have a right-sided heart failure, what is the sign and symptoms you see? I'm not going to give that away. You should know it. If you are going to write the exam this weekend, you should know it. If you don't know it, please do not near NCLEX building. Talk more of opening the door. You don't have any business with touching that door. You don't need it. All right. And when a patient swallows barium for any kind of examination, any kind of test, nurse, what will be your teaching? Teach that patient to drink a lot of water, a lot of water, a lot of water. Okay? Yeah, that will be the umbrella answer. Drink a lot of water so the person can pee out that barium. If you don't pee out that barium, it will do what? You can make your tummy to be this hard, like rock. Please tell that person, keep drinking water, keep drinking water so they can pee out that barium. Okay? Yeah. After a patient gets a permanent pacemaker for 6 weeks, it might not, the NCLEX might not say 6 weeks, it might say more, but just know that you tell this person, you see that this, your hand, do not use it vigorously. Do not, okay? Until the MD, the physician, okays you, until the physician okays you. Some people told me they saw that question last week. So I'm bringing it in. I'm listening to people. People are talking. I'm listening. All right. What is pernicious anemia? What causes it? Please, I don't want to give that out. Please look for it. Look it up. Look it up. Look it up. I talked about dumping syndrome yesterday. Go and watch that video for yesterday. Dumping syndrome. The position to keep a patient with dumping syndrome, where they are feeding After they've done feeding, you need to know all this. Liver biopsy, I talked about that yesterday. I'm not repeating that today. And I talked about the blood yesterday, how long a blood should stay after you take it out from the blood bank. How long do you need to keep it more before you give it to a patient? And what is the duration? How long will that blood run when you are transfusing the blood? How long should it run? You need to know that. When a patient have fistula, well, let me just break it. Like all the like a cancer patient who is on TPN, who is on people, anything that that this person is having one thing dragging out from the hand, from the chest, from the clavicle. Please do not use that side of the extremities to take any vital sign. I don't care whether you are poking it or you are whatever, do not use it. Okay. The same thing applied to someone who had breast cancer surgery. Do not use that part of the hand. Please, not even when you are teaching this patient, tell this patient, don't even carry handkerchief on that arm. That is how serious it is. Do not carry even handkerchief on that arm. Talk more of your purse, talk more of your phone. Just let that hand to rest. You need to rest, okay? You don't need to use that hand for life. For life, please. For sickle cell patients, teach them not to wear tight clothing. Adam from Beautiful Money here, my beautiful money to you, Adam from how are you? Thank you. I'm just having a class. Yeah, so you're welcome. Please teach a sickle cell patient not to wear tight clothes. Yeah, please. That is big on NCLEX. Teach them not to do strenuous work. Teach them to cover up in cold weather. If a normal you will wear like normal person who is not sickling, if I will wear like what I'm having now and one layer of jacket, tell a sickle cell patient to double up. Okay, just like we do for kids, for babies, just tell them to double up. They need to cover up very well, and tell them, please do not smoke. Don't try to constrict that blood. Don't try to constrict that blood, because that blood is constricting it already, it's sickling already. So do not smoke. Do not smoke. If you see any of these options, choose it. Is the right answer. Yesterday, I talked about angina pectoris and MI. Go and watch that video. If you're still having difficulty with that, go and watch it. I think I've surpassed my 30 minutes, but it's okay. I talked about hemophilia yesterday. Watch yesterday video, please. Yeah, watch it. I don't want to repeat things. I told you to know the glaucoma scale. Please know it. Know it. If you are studying privately with me, I think I know I gave all my students a lot of things, and I really dissected it, so you don't have to go start reading. Know the 12 cranial nerves. I talked about that yesterday. Please, if you are writing this exam and you don't know the 12 cranial nerves, NCLEX will not just ask you what are the 12 cranial nerves. They will embed it in a question because all the 12 cranial nerves is attached to a system. And if you don't know it, don't ask me. I won't tell you. You need to go know it. You need to know which cranial nerve works for what. You need to know it. When they tell you it's for chewing, you know what they are talking about. Facial, you know what they are talking about. Looking side by side, you should know what you teach your patient. If you don't know it, I don't know how you're going to write your exam. And if you're having an exam this weekend, I'm sorry. I'm sorry, I can't help you. Please help yourself. And I talked about dilantin. They are very heavy on dilantin yesterday. Go and listen to yesterday's video. It's right there. It's free of charge. I'm doing this free of charge. Patient with ALS, MG, all these GNS disorders, please, if there is any answer that is talking about respiration, that is the answer. That is the answer. Okay? Yeah, they all have respiratory problem. They all have it. Okay? Yeah. I don't want you to be reading. I said something about the best policy. So please watch yesterday's video. Compartment syndrome, I did that yesterday. Please watch it yesterday. Phantom pain, I talked about it yesterday. Watch the video for yesterday. What causes osteoporosis? Osteo is talking about blood porosis, water in the bone. What causes it? I will do that as a giveaway. Yeah, it's because that person don't have enough calcium and estrogen. So, and if person have a gastrectomy, all these people that have, cut some of their gastric, and maybe they want to lose weight and all those things, yeah, they are at risk for osteoporosis too. Please, osteoarthritis, you need to know what it is. I'm just, this night I'm not giving the easy one. I'm trying to give you. And why does a pregnant woman, why do we do non-stress test for a pregnant woman? You need to know that, please. Okay? Why do we do it? Should I give that as a giveaway? Or should I let you go look for it? Okay, we do it to know the period the baby moves in the womb. Please. That is just the answer. Oh, Miss Christian, I said 30 minutes. It's okay. Yeah, when a woman in early pregnancy, first trimester, you know, please tell that woman, and she comes for any kind of ultrasound and all this thing, just tell her, give her water, hand that water over to drink. She needs a full bladder, very full bladder, before a sonogram can be carried out on her. You want to see what is in there. Okay. And I gave the easiest way to solve for Nigel rule. That's why I'm doing my private tutoring. I won't give everything out for free, but I'm just doing this for those of you writing your exam anytime soon. What do you say in placenta previa? You need to know. And what is true labor? How do you differentiate true labor from forced labor? You should know that. What did I say? You should know that when a woman is having a true labor and when a woman is having a forced labor. You need to know that. Please, if you don't really know maternity, you need to. They are getting big on that now. Know how many minutes interval you take the child ABGA score. You check it. Please know how many minutes you take the first one and from when you take the second one. You should know all that. Know how many arteries and veins the umbilical cord have. You need to know that. When a child is having a nasal flaring, do you know what that means? I would give that as a giveaway. It's a sign of respiratory distress. This child is having respiratory problem. Please, please know the sign you see when a child is dehydrated. Make sure you know that. The Mognania spot, don't worry about it. It's nothing. You just wash it. It's just like a birthmark. We call it birthmark from where we come from. It's like a birthmark. It disappears in the first year of the child, okay? Don't worry about it. It's normal. But when it starts like expanding from the normal size, what you do, some question will tell you that you measure it and know the size. Just you keep your eyes on it. But is this something to call the doctor for? No. A lot of people told me they saw that on their questions. No, you don't call the doctor for it. It's not needed. Do not. When a child is having a bulging fontanelle, bulging is rising. That is problem right there. That is ICP. Yeah, bulging. And when it is sunken in, that patient, that child is. I don't know why I'm giving this very easy. What you not give me? What do y'all give to me this night? I mean, this early morning. Okay. So when that child is dehydrated, that child needs water. Need water, 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 water. Know the direct combs and the indirect combs. What is combs? To excuse me, to start with, COOMBS. Please look it up. You need to know it. If you don't know it, please don't go write that exam. There's some things I don't want to give her, but yeah, yesterday I talked about a child who is breastfed and the child who is formula fed, the color of stool these babies have, you need to know it. Not one, not 10 people came back telling me that they saw that question. You need to know it. I will give one away. Oh, Miss Christiana, why are you doing this? Okay, for a breastfed um, child, baby, they have a golden yellow stool. Golden yellow poop, shit. That is what they have. Golden yellow. Okay. And they have about 6 to 10, small bowel movements in a day. But when a child is formula fed, this child have dark green pastry stool. I know a lot of people will be shaking their head. When I have my baby, yeah, I know she was having a golden yellow stool, and later I saw this my baby start having that green stool. Yeah, that is when you start giving formula. That is what happened. Um, I think I should stop. I think I should stop it here. I'm giving too much away. Um, yeah, please, you need to. I said that yesterday on my video for children of all ages. You know, the milestone things, you need to know it. Someone told me that her question, they asked her, 3 years old child, what are they known for? And she was just looking like this. I said, what was your options? And when she was giving me the option, I said, uh-huh. Which one do you think is the answer? She was staring at me like, I don't know what to say now. And Miss Lynn on me will say, you get it wrong. She said, I said, um, he said one of the answers said they said mama. That is the time they say a 3 years old child, mama. I said, What was the second one? He said, the second, I've forgotten, but the third one, he said the answer she saw there was that is when they say my is mine. They fight for my is mine. I say yes, is mine. That is the answer. Eh? Yeah, is about 1 year, 18 months that said the other word I just said. But at 3 years, if a 3 years child is just say mama, mama, oh my gosh, we need to start being worried. Please know how they play. Play. I don't want to, I have everything, but I'm not giving it out. Yes, please. Because I use this for my main class. Um, Go and know the developmental of the children, the milestone, please. Know it is very, very important. Is very, very important. If you have not been listening to McClemick, just go to my playlist. You will see McClemick NCLEX review. Go and listen to it before you near that piercing view door. Go and listen to McClemick. You can listen to McClemick, all his systems, and go write your exam feeling very, very good. Please go and listen to it. If you have not subscribed to this channel, go and subscribe because I can pop out anytime and we start talking about what I'm talking about right now. I don't want you to miss. Tell your friends who are studying for NCLEX that lean on me with Cristiano Keke. I am doing some silent night with everyone so they can take advantage of that. They should just sign up. You can sign up with Lean On Me with Cristiano Keke, or you sign up with Smash NCLEX Review. I am on the two channels right now. So wherever you are watching me from, you know that I am live and I am giving you what you're supposed to know. What is Kawasaki disease? What do you see in children with Kawasaki disease? Please, you need to know it. Please, 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 I'm begging you. You need to know that. Um, when is the best time? Yes. Oh my God, it's like I wrote this exam with a lot of people. When is the best time if a teenager with a scoliosis, you see how I bend scoliosis? When is the best time? Best time? Some people have that question. And when is the best time and how long should they wear the Milwaukee brace, the brace they wear? When is the best time the mother will even think of taking them to the doctor? Please, I'll give this as a giveaway because a lot of people don't know the answer. The Milwaukee brace, they wear it. Please, the mother should make appointment for them during summertime when they are on summer break. Remember, the teenagers, they are into their body. They are concerned about their body so much, and they are into their peers, that is their friends. They don't want their friends to see them wearing it to school because you wear it on your school uniform, on your clothes. They don't want their friends to see them wearing it. So mommy, make appointment for your child if you want to correct scoliosis during the summertime when they're on summer break. Okay, that is the best time. A lot of people got that question and they say they don't even know what to choose. Choose that, and they wear it 23 hours in a day. They only take it out to take a bath and put it on back. Okay, I give that away. Pure NCLEX tips. I'm giving this NCLEX tip away. Miss Christiana, Brian traction. Who uses Brian traction? I'm not going to give that away. You should know it. Yes, please, you should know that. I won't give that away. Brian traction. You should know it. I won't give it away. I was thinking if I should give it away. No. Please, any child, any child with any kind of congenital heart disease. Congenital means born with. Okay. So when a child is born with any kind of congenital heart disease, tetralogy of Fallot, all those, please, what you do is to try and reduce what? Reduce the work of the heart. Please try as much as possible not to make this baby cry. It's too much load for that child to cry with that kind of disease, okay, that kind of problem. Yeah, I know when you're like, oh, what is she trying to say? Yes, with any child with any kind of heart disease, try to reduce stress for that child. And the cry is number one way to increase stress on a child. And don't stop food like those of when we are growing up, when they don't eat, we don't eat, our parents we hold your hand, hold this. You want to kill that child. You don't stress that child up. You don't stress that child up. I think I should stop here. I don't want to give out a lot. I have given some, and it should be enough for now. So I'll still have some for my students. All these delusions, and you need to know it. What is delusion? You need to know that. That's why I am referring you back to McClemick. I am referring you to McClemick, and I know why I'm referring you to McClemick. Please, if you are studying for your NCLEX, you will be writing this NCLEX very soon, or maybe in 1 year, 6 months. Please start listening to McClemick review. I have it free of charge for you. Go and start listening to it. It will do you a lot of good, and you will come back and say, thank you, Miss Christiana. I passed. You know, I like that word. I passed. Yeah. Do I really want to do psych this night? No, I don't want to. All right. I think I should stop here. I am sorry, guys. I need to stop here. I know you enjoyed this little time. Oh my God, I'm here 1 hour. Oh my God. No, I thought I would be here 30 minutes. It's 1 hour already. I just love what I'm doing. I'm not regretting that. So, my beloved viewers, my students, you are all welcome for studying with me during the little silent night with me. Thank you for always coming around. And please, any tip I'm giving you, especially these endless tips I'm giving you, do not take it for granted. Do not. Do not. And if you want to study one-on-one with me, as you all know, I moved my studying to Zoom. So if you want to study one-on-one with me, you can join me. I am still waiting for my website to start running. But before then, I am using other means. So you call me on +1-832-973-9937. Do not call me. I'm sorry. Just text me. I will reply you, and I will book an appointment when to return your call, and we take it from there. Please, if you want to do the private studying with me, I am very cheap. Just call me. I really want everyone to pass NCLEX. That's why I'm doing this. I'm not doing it for the money, because if you're not doing very good, I will drop you. I don't care how much you give me. I only care about your success. I just like that I pass. And with that, I pass. I pass. I pass. I pass. It gives me joy to hear that word, I pass. So I'm doing this for all of us. I want us to pass. I want everybody to be happy. I want you to be able to buy hamburger without thinking or knowing how much will be left in your account. Even if you have 10 kids and you have to buy for them, you don't have to start waiting for until you get a coupon to buy hamburger. You spend that money, you spend it because you are making good money. I want everybody, my friend will say, I am now financially whatever. I don't know how she put, but yeah, like when you are financially okay, you'll be spending money. Okay, so thank you for studying with me. And with that, I said, remember, you are unstoppable. And your voice must be heard, because when you becomes a nurse LVN, nurse RN, your voice will be heard. You'll be speaking loud when you attend an occasion, or when someone have a need. You could, just help out without thinking, if I give this person $50, I, I will have $50 left in my account. Yes, please. So I will see you all some other time. I'm not promising you I'm coming back tomorrow, but anyway, you can predict. I can predict myself. I will see you all when I see you. When I don't feel like sleepy, like now, I will come up and give you a lot of tips that I have for you. Until then, I said, bye. Thank you all.